Welcome to the world of mediCAD.
My name is Dr. Klaus Schlüter-Brust. I'm the leader of the orthopedic surgery division for more than 10 years. We are specialized in orthopedic surgery, endoprosthetics, and revision endoprosthetics.
My name is Professor Dr. Schröter. Since the 1st May of 2020, I have moved to the Diakonieklinikum Jung-Stilling in Siegen and have taken over the management of trauma surgery and reconstructive surgery.
I've been using the mediCAD 2D software for more than 10 years in this hospital. For 5 years I've also been using the 3D modules of mediCAD in shoulder, knee and hip. However, due to the fact that I wanted to see the plan three-dimensionally and not on a two-dimensional monitor, the company and I came up with the idea that we enable this for the HoloLens. This was a milestone that I was very interested in.
I was very euphoric when I wore the HoloLens for the first time and could see a very recent case. It was a very complex pelvic fracture, which has been transferred from computer to the glasses. Suddenly, I could walk into the pelvic fracture and have a look from the inside. This gives me a completely different view of the morphology of the fracture pattern. This was very impressive.
Once you've seen that the anatomy is in front of your eyes and you can see it exactly as it is, if you can then compare it with reality and then have all the three-dimensional planning data in front of your eyes, you simply don't want to do without it anymore. Because it gives us security, because it gives the patient security, and because sooner or later it will significantly improve the quality of surgical procedures.
Since we now have the possibility to better prepare for surgical interventions with the planning tools, care is more qualitative. Due to the fact that we can transfer the whole concept in the operating room, mixed reality, HoloLens, as well as 3D animation, and due to the preoperative planning, we raise the whole treatment and preparation to a new level and to a new standard, and can continue improving the quality in the future.
Of course, in the beginning I had doubts regarding HoloLens because of the references I read online. For example, I heard about seasickness and nausea. I heard about usage issues. And I was afraid that the HoloLens would bother me during the surgery. However, after testing, I couldn't understand all the concerns.
In the beginning, I was not used to the weight of HoloLens on my head during surgery. However, in the short time that I have been using it, my experience has shown that this is not really a problem.
The great advantage of having the glasses and the planning in advance is that I have the exact patient-specific anatomy in front of me pre-operatively. In the operating room, I can compare the planning with the real situation and have all the planning data that I have determined three-dimensionally for the size, position and shape of the prosthesis in front of my eyes, and can compare this with how it has to be positioned in reality. These are huge planning advantages. This is actually also a time advantage intraoperatively, as well as the benefit that I can save trays, and in addition to the advantage of saving instruments because I know exactly what to put where.
Planning, patient safety, quality of care. In addition, I can of course project information from the normal HIS system onto the HoloLens if I want to have a further look at current laboratory data, or if I want to have a look at the patient's medical history during the surgery.
The streaming function of HoloLens combined with mediCAD software is very important, because there are always intraoperative situations that may require a second surgeon. The more complex the procedure, the more a second opinion may be needed, even intraoperatively. In some cases, I would be wise also to involve various representatives to ask questions if necessary. Streaming makes these features possible, and we will need these more and more for the benefit and quality of our patients.
There are many operations which are not that frequent, which one always struggles to integrate into the training. The HoloLens streaming function, which enables recording as well as saving, gives me the opportunity to demonstrate to young doctors and explain the experiences directly from the operating theater or afterwards. Thanks to the recording, complex cases can also be discussed afterwards. Just like the CT during a surgery, mediCAD MR and HoloLens will be an elementary part of the daily operative procedure during surgery in future, due to the fact that I can visualize a three-dimensional problem.
If I want to convince a colleague of the mediCAD MR features, for example, I recommend them to just put it on. See your patient information in 3D in front of your eyes. Walk through the model, turn and twist it, and then realize the many possibilities you have with it.